All right, well, hello everyone and welcome. For those of you who don't know, my name is Grace Strauss and I'm the Assistant Director of Communications and Alumni Engagement here at the School of Nursing. Before we get started, I just want to cover some quick housekeeping items. First, we ask that you please remain muted except during applause. Definitely please partake in that. And then after the awards presentation, we do welcome you to stay on Zoom for more informal chat, so please stick around. So with that, I turn over the presentation to Dean Marshall Lewis.
Thanks so much, Grace. Well, good afternoon again, everyone. It is wonderful to see new faces and faces that we've seen for many years, and a chance to an opportunity to, for the School of Nursing to celebrate and come together to celebrate our collective achievements over the past year. We'll be celebrating our distinguished alumna, distinguished preceptors, and the Garman Award recipients. But we also want to celebrate the fact that given this year has been a very dramatic one, we have had a very successful year in the school. We've graduated our class the last week of about 200 some students. Last year, in 2020, our undergrad class took their NCLEX exam with a pass rate of 98%. So in spite of the pandemic and in spite of all that was going on, our students persevered, our faculty persevered, and we moved forward. We also have had a very productive research year. Our research expenditures, the number of grants we have both submitted and received has increased quite a bit this year, and we're very pleased about that. And some of that research is also focused on COVID and the aftermath of COVID. So it's very relevant and very important research. So we're very excited that we have something to celebrate. We have alumni here, we have donors, we have faculty, staff, and students, and we're so thankful that you're all here. So in spite of what we've already said, that this is not the way we want to do it, we wanted to make sure that we were able to award and honor those who've done so much for us this year. And that's pretty much why we're here, to be able to thank all of you, but to particularly thank those who will be getting awards this year. So let's begin our presentations. I feel badly because usually this takes about an hour and a half, but that's because we're talking and eating and drinking. And I'm afraid our presentation here is going to go much quicker than I will want it to. But we will certainly be planning to have an in-person May celebration next year. I can't imagine, crossing all our fingers, I can't imagine that there will be any reason not to do that. So our annual awards are presented to those who have distinguished themselves as leaders during their careers or for their tireless efforts to advance the profession and the mission and values of the UB School of Nursing. Our first award was created as a tribute to a very dear alumna and champion of the School of Nursing, the late Patricia Garman. Pat was a steadfast supporter of the School of Nursing through her generosity of time and the establishment of the Patricia H. Garman Behavioral Nursing Endowment and Professorship. Because of her commitment and generosity, many people, including many on this Zoom today, furthered their research through Pat's fund, left behind a powerful legacy. The Patricia H. Garman Award for Excellence and Service in Nursing is presented to someone who exemplifies all that embodied her many contributions to the university, our School of Nursing, and to our Western New York community. I am proud to present the 2021 award to an outstanding group of individuals who were instrumental in planning and implementing of a pilot mentorship program at the UB School of Nursing, which launched in January. And the award winners are Willa Arnett, Brentnie Adams, Kwasi Aduse, Shadivia Marshall, Sophia Overton, and Tanika Pace. Following the civil unrest related to racially charged incidents in 2020, the School of Nursing held a town hall for students to express their concerns and needs regarding confronting systemic racism in their personal and professional lives. Students, particularly students of color, expressed that they struggled with responding to and confronting racism they encountered in clinical experiences and sometimes in the classroom. They also expressed a need for mentorship from nursing professionals of color who could provide more meaningful guidance in these situations. Despite having a plethora of personal and professional obligations, our award winners generously took the time to meet with our Justice, Equity, Diversity, and Inclusion Committee, help formulate a needs assessment and mentor-mentee profile surveys, meet with students, and become mentors. Their passion for advancing nurses and students of color are a testament to their dedication to the profession. We credit these remarkable individuals with our ability to launch this mentorship program in just a few months, immediately providing mentorship to undergraduate students of color. In doing so, this group has reflected our school's mission, which is to foster an environment of academic and scholarly excellence that develops nurse leaders who will improve the health and wellness of local, national, and global communities. The school's vision, which is to achieve a collaborative academic educational excellence, and our values of integrity, collaboration, accountability, respect, and excellence. I would like to acknowledge and applaud each mentor individually. The first mentor is Willa Arnett. Willa is an adult health nurse practitioner and a 2017 graduate of the UB School of Nursing's Adult Gero DNP program. She also earned her master's from UB School of Nursing in 1998. Her career spans 22 years in subacute, long-term, and in-home health. She began her military career of 15 years as a combat support medic and was later commissioned as a registered nurse in the U.S. Army Nurse Corps Reserves in Niagara Falls. Willa is currently a nurse practitioner at IPC Healthcare, Team Health, and Fallon Health. Please unmute and give Willa a round of applause. We will do our best with the applause. It sounds much better in person, but Willa, know that everybody's applauding you. I would like to ask Willa if you want to say a few words.
Sure. First of all, thank you for
Willa, your mic is muffled. It's kind of hard to hear you. Let's try again.
Can you help me? I don't know. Okay, maybe if I come up closer.
That's good.
Is
That's
that
good.
better?
Yep, that's great.
Okay. Okay, I just want to thank the School of Nursing for the acknowledgement, and I want to thank my friends and family for being there. It has been a pretty tough time as well for everyone else. I think this is the first step, that the mentoring program, and acknowledging that we do have a problem that needs to be addressed and fixed. I would like to see this program even extend further into the high schools, to start from the very beginning, and then mentorship go throughout the undergraduate process. So I am thankful and honored to receive this award, and I wish that we continue to move forward. Thank you.
Thanks so much, Willa. Your points are very well taken. We know that this needs to start way before nursing school, but here's our first step. And I also want to let everybody know that this was the first step this year and is going to continue. And our plans are to have it grow every year. So we will keep moving forward with your pioneering spirit. Our next award winner is Brentnie Adams. Brentnie is a registered nurse and nurse evaluator at Maximus and a clinical instructor at Trocaire College. She earned her Bachelor of Science in Nursing from Duval College and her Master of Science in Nursing from Damon College. She's a recipient of the Mary B. Talbert Civic and Cultural Club 2019 Community Change Makers Award in recognition of her outstanding leadership, civic commitment, and cultural contributions to the Buffalo community. She also brought invaluable insight into our mentorship program for students, having been instrumental in mentoring nursing students at Trocaire. Let's unmute and give Brentnie a round of applause. Brentnie, are you here? I didn't think I saw her. I don't want to go by too quickly if you're here and you just still need to unmute. Okay, we'll move on. Our next award winner is Kwasia Duse. I saw Kwasi, I know he's here. Kwasi is a psychiatric mental health nurse practitioner and a recent graduate of our Psych DNP program at the UB School of Nursing. And very close to my heart because I've been a psychiatric nurse for almost 50 years. He currently works as a psych nurse practitioner with Horizon Health Services, where he's involved in conversations targeting solutions to mental health stigma, access, and inclusion in communities of color. Let's unmute and give Kwasi a round of applause. Kwasi, I hope you'll have a few things to share with us.
I do, yeah. You know, I'm always really just impressed with the work that the School of Nursing does. I've been really inspired by my experience. You know, as you mentioned, I am a recent graduate, so I graduated from the nursing program in 15, and then in 19 graduated from the Psych DNP program. And throughout that period of time, the people who've been supportive of not only me, but all of the people that I went to school with, graduated with, just continue to amaze me. So many people in this call, you know, Suzanne and Janice, and, you know, Dr. Nisbet and so many people I feel really grateful for and thankful for. You know, this program in particular is obviously really important, you know, and as much of there is an issue of reducing some of the harms that are built into some of the systemic racism that we experience, there's also a piece there that is about belonging, right? It's this piece for all of us where we're wanting to be acknowledged, all of us, every one of us, despite the color of our skin, you know, how we're showing up, and, you know, opportunities to be able to do that through systemic means, you know, with the support of the faculty, you know, an opportunity to sit and work with the people who are being honored today. I'm really inspired by all of you. So just grateful, and thank you so much for the acknowledgement.
Thank you, Kwasi. We are so proud of you. The next award winner, Shadivia Marshall. Shadivia received her bachelor's degree from Duval College. She's worked in the ICU, med-surg, long-term care, and the insurance industry. Prior to moving to the insurance industry, she was the director of nursing at Canterbury Woods Assisted Living Facility. Shadivia is an employee liaison for the Travelers Black and African-American Allies Diversity Network, as well as their Women's Diversity Network. She connects the employees at Travelers with community-based organizations that serve marginalized groups through outreach activities, such as volunteering at the Buffalo City Mission and participation in the Buffalo Juneteenth Committee. Let's unmute and give Shadivia a great round of applause. Shadivia, I hope you'll say a few words to us.
Yes, thank you. I just would like to thank you all for this prestigious award, and it definitely is humbling. I do want to echo the sentiments of everyone before me that this is very important work, not only to support the students, but also to broaden the minds of the staff and faculty involved in selecting students and educating them and making them successful in their careers as a community and whole. And I'm just grateful. Thank you guys so much.
Our next award winner is Sophia Overton. Sophia received her Bachelor of Science in Nursing degree and Master of Science in Nursing Education from Damon College. Over the course of her career, she found her passion in educating underserved populations in healthcare maintenance and advocacy. Recognizing the impact diabetes has on the African-American population, Sophia joined Catholic Health Systems as a patient educator with a focus on diabetes. Sophia is also an adjunct clinical instructor here in the School of Nursing. Please unmute and join me in congratulating Sophia. Sophia, please share a few words with us.
Okay, can you guys hear me okay?
Yes.
Okay. So really, I would just like to thank UB for inviting me to participate in the mentorship program. I was a bit nervous at first, not really understanding what was required, but I'm glad to have had the experience. I hope to continue to make a difference in the students' lives and hopefully impact how nursing and in schools, how they select us to become part of nursing programs and the experiences that some of the students will have once they go out into the field, hopefully help them to understand what's happening and how to deal with it. So I really do appreciate the invite, and I look forward to the future in this nursing program, mentor program.
Wonderful. Thank you so much, Sophia. And the final awardee is Tanika Pace. Tanika is a registered nurse and a certified case manager who received her Bachelor's of Arts degree in African American Black Studies and Bachelor of Science in Nursing degrees from the University Buffalo School of Nursing. She has also earned a postgraduate certificate in nursing leadership and executive change from Damon College. Tanika is currently a workers' compensation medical care team lead at Travelers and is an active member of the UB Alumni Association and the American Nurses Association. Please join me in congratulating Tanika. Tanika, please share a few words with us.
Yes, thank you so much. I just am overwhelmed with excitement and the possibility of continuing a mentorship program through the University of Buffalo. Part of the reason I became a nurse is really to have the ability to give back to my community, to give back to up and coming nurses. So I'm just overjoyed and overwhelmed that we are able to start a program with the university, not only for the students, but so that the university now has a pipeline to help increase diversity throughout. I'm excited, honored, privileged to be a part of the planning, coordination, and the implementation of the program. And I am really excited to see where this goes in the future. And thank you so much for the honor of this award and for allowing me to be a part of this process.
Thank you, Tanika, and congratulations. Congratulations to all of you. But mostly it's thank you to all of you for you heard when I was reading what all these people are doing. It's not like they're sitting around eating bonbons, is it? They are pretty busy people, but they were willing to step up and join us. And I think that's going to be an incredibly invaluable experience. We keep talking about how can we make our nursing faculty more reflective of not only our student body, but also of the community. And I keep thinking that one of the ways we're going to be doing that is through growing our own. And so part of my hope is that if we can continue to mentor students, they will see the value of moving forward in their careers and eventually wanting to join the UB School of Nursing as whether it's alumni, whether it's an adjunct faculty member because they want to keep working full-time, or as a full-time faculty member. So I thank you for all that you do. And as I said, we will continue this work, but we will need your help and hopefully be able to expand and find more people who would be willing to share their experiences and their care for passing it forward. You know, what you've learned, how you can pass that forward to others. So I couldn't be more proud. My heart is full. I thank you all so much.
Thank you.
We have some really interesting awards this year because normally we give one award, and we've had just such an incredible experience with so many people that we couldn't just give one award a lot of times. And that's the case also with our Distinguished Preceptor Award. We will be giving 2 preceptor awards, one for our undergrad programs and one for our graduate program. We're always so grateful for our preceptors because they certainly provide a wonderful experience for our students. They help them to really become a part of the work experience, and that's so important. So this year, the Distinguished Preceptor Award for undergraduate programs is presented to the Sisters of Charity Hospital Neonatal Intensive Care Unit, Mother-Baby Unit, and Labor and Delivery. And that's because of all that they've done. So I'd like to read a little bit from their nominator. And the nominator said, instead of an individual person, I would like to nominate the entire team of our maternal newborn DEU Hospital. The managers, along with the nursing staff, have been tremendous in taking students during this challenging time. They never once denied us our DEU experience and even accommodated our needs to have 2 students groups a day on their units. They continue to provide our undergraduate students with a valuable maternal newborn experience. These managers and nurses have shown our students that nurses need to work together, especially in the midst of a pandemic. They continue to work with our students to provide an optimal DEU nursing learning experience in the maternal newborn setting. The nurses highly value clinical education and its importance to their future nursing colleagues. We cannot express how grateful we are for this incredible group of nurses and managers. Let's unmute and give them a rousing round of applause. I'm just wondering if there's anybody from Sisters that would like to represent them and just say a few words to us. Just unmute and talk.
Hi, this is Tori Kaczynski. I hope you can hear me. Sorry, my video is not working.
Yes, we can hear you.
Okay, great. Hi, I'm the NICU nurse manager from Sisters, and we just wanted to say thank you so much. We're honored to receive this award from UB. Having our students with us during this crazy year has meant a lot to us as well, and we were happy to be able to provide this clinical experience for them. I know it's a scary year to be a nurse and to be training to become a nurse. So I commend all of them for sticking with it. And I hope that they all enjoyed their clinical experience with us. I really have to give credit to our nursing team who, still rose to the occasion and took nursing students when sometimes it can be a challenge, but we really do have a great team and they love teaching, and we all were students once and we try to remember that. So thank you again for this award. We're truly honored.
Thank you so much, Victoria. Our second Distinguished Preceptor Award comes from our graduate program. And this year's award goes to Ryan Florence. Ryan is a CRNA for Maple Gates Anesthesia at the Millard Fillmore Suburban and Gates Vascular Institute. Here is some of what his nominator said. As the pandemic threatened our nurse anesthesia students' access to clinical sites in the fall of 2020, Ryan Florence stepped up and advocated for all of our students to remain in clinical training. He sent an extensive email to Kaleida leadership detailing the skills and important role our students fill in the operating rooms at their hospitals. His words educated those administrators on the advanced practice nurses' contributions and scope of practice, and they did allow all of our students to continue the required training in their facilities. Without Ryan stepping up and speaking out, almost half of our second-year anesthesia students would be without a clinical site to obtain important cases and hours needed for their graduation requirements. We are so grateful to Ryan for his advocacy and dedication to our students. Let's unmute and thank Ryan. Ryan, would you like to say a few words?
Sure. I am really honored to receive this award, and I'm especially considering how many wonderful preceptors are out there and working with these students, and from the pool in which I was selected. And I'm grateful to be able to work with the students. And I was blessed in my training to have amazing preceptors that helped to train and teach me. And I love to work with the students and try and emulate what the wonderful preceptors that I had. I try and emulate what they did for me, and pass on the knowledge and skills that we have to the future of the nurse anesthesia field. And I am very grateful for this honor. So thank you so much.
And thank you for all that you do for us. I think that's what's so important. We have our nurses realize that they were students once, and they want to get the students the best possible experience they can have, so that they can move forward and be successful, just as you all are. And I wish you all the very best of success in your careers. It's been about a half an hour, and I wish this was able to go on longer, but like I said, if we could eat and drink together, it would. So our final award this evening is the Distinguished Alumni Award. This award is presented to a UB School of Nursing alumnus in recognition of their exceptional career accomplishments, community or university service, or research and scholarly activity. It gives me great pleasure to present this award to an outstanding alumna, Dr. Marie Ann Rosenberg. Marie Ann received her Bachelor of Science in Nursing degree from the UB School of Nursing, a master's degree and a PhD in nursing with an emphasis on occupational health from the University of Washington. She was a postdoctoral fellow at the University of Michigan School of Nursing, where she is currently an assistant professor. Marie Ann's program of research focuses on optimizing the health of low-wage service workers at risk for experiencing one or more chronic conditions. Here's some of what her nominator said. Dr. Rosenberg is one of the few nurse scientists nationwide whose work focuses on occupational health disparities among at-risk, low-wage youth and adult working populations. Her unique contribution addresses the significant gap in science related to mitigating socio-ecological stressors and redressing the associated pathophysiologic and maladaptive behavioral responses and tertiary outcomes among vulnerable workers. Dr. Rosenberg's work is significant in that for close to a decade, she has been highlighting work as a social determinant. Yet it is just now that major entities such as the National Institutes of Minorities and Health Disparities are beginning to push forward the notion that work is integral in the multi-layer factors that affect the health and well-being of vulnerable populations. Dr. Rosenberg is known as a leader in the study of occupational health disparities. Through her funded work, she's applied the allostatic load concept to capture multi-systems dysregulations as an early warning system for later disease states relating to traumatic or persistent stress among vulnerable workers. She is the first to apply this innovative concept to underscore the pathophysiologic stress response of hospitality workers due to chronic stress exposure. With close to 40 peer-reviewed publications, Dr. Rosenberg also serves on several national community committees and is currently contributing to the development of federal guideline for organizations and agencies employing temporary workers. Isn't that what we all talk about with our research? How can we get that research to the policy level? And Dr. Rosenberg is doing that. Her work is leading to interventions across individual, organizational, and policy levels to improve the health and well-being of vulnerable workers, making a significant contribution to science and advancing the nursing, public health, and occupational health fields. In summary, she has demonstrated a record of pertinent expertise and accomplished and productive research activities in areas of high relevance to workers' safety, health, and well-being. Please unmute and give Marie Ann a great round of applause. Marie, congratulations. Please share some of your thoughts with us.
Thank you so much, Dean Lewis. Before I start, before I say anything, are there any students on the call today? Are there students? Can you guys hear me?
I can only see a few people, so I can't tell you. I know Meg Borsbacher is both a faculty member and a PhD student, and I'm looking right at her.
Oh, okay, great. Well, I did write a few notes, and I realized when I heard the other awardees speak, maybe I should shorten what I wrote, or should I just read everything really fast?
Tell us what you want to say to us. We're eager to hear.
Sure, thank you. Thank you for having me and having me join this important and joyous event. And I would like to extend a big congratulations to the class of 2021. It is such an honor to be a recipient of this distinguished alumni award. I would like to say a sincere thanks to my colleague, Dr. Kafui, for nominating me for this prestigious award, and to Dean Lewis for taking the time to connect with me about my work and my passion for this wonderful profession. This award is particularly special to me because UB is where it all began for me. Having moved to Buffalo just 2 years after emigrating from my home country, Buffalo, the University of Buffalo, and particularly the University of Buffalo School of Nursing, have allowed me to accomplish my many firsts and create lifetime relationships and memories. In Buffalo, as I worked as a nursing assistant at the Sisters Hospital throughout my entire undergraduate nursing studies, I got my first experience to be part of a hospital system in the US. During my nursing training and clinical rotations, I learned what it meant to be a nurse, to be part of something bigger than me, part of the most trusted profession. I got the opportunity to learn from excellent nursing faculty, including Professor Jones, who is on the call right now. Hi, Professor Jones. I became a US citizen in Buffalo. I made longtime friends and colleagues, some of whom were my bridesmaids, and many of whom are doing great things as healthcare professionals, such as nursing BMPs, PhDs, NPs, and physicians. Met my life partner at UB and got engaged by the Niagara Falls. So I really hold UB and Buffalo really close to my heart. At UB, I got my first exposure to research. As a research assistant to Drs. Linda Cayley and Nancy Flanagan, that's when I realized that nursing is so versatile and can be more than direct patient care, and that one could make impact at the larger systems level through research. I began to develop a deeper passion for evidence-based practice. And this is where I got my first experience to disseminate research through presentations and conferences. At UB, I got the opportunity to experience and apply leadership skills as the president of the then Minority Nursing Student Association. During this leadership opportunity, I got the opportunity to give back to the community, as well as appreciate the importance of inclusion. So you all can now imagine how much this award means to me. And I did have a little blurb for the class of 2021, the undergraduate class. I hope you really take the time to reflect on your wonderful accomplishment and what it means to get your nursing degree from such a prestigious institution. Yes, this is an odd time. However, this is your time. Now more than ever, this profession, the nursing profession, you are the core of the health and well-being of the population. And if you have not done that yet, I guarantee you that years from now, you will sit back and ask yourself, where did it all begin? And you will have no choice but to realize that and say to yourself, you be. Thank you.
Thank you so much, Marie-Ann. Wonderful words. And we're very proud to count you as an alum of the School of Nursing. We have, all of you are phenomenal, and we couldn't thank you enough for all that you do for patients, for each other, and certainly for the School of Nursing.
Dean Lewis, I apologize for the interruption, but Brentnie Adams has joined us. So
wonderful.
We're going to take a moment just to go back to her slide and hopefully give her a moment to share a few words.
I'm going to find Brentnie. So there we go. So I can talk a little bit about you. Brentnie, so glad you could join us. Brentnie is a registered nurse and nurse evaluator. I think I told you that at Maximus. And she is also a recipient of the Mary Talbert Civic and Cultural Club 2019 a Community Change Makers Award in recognition of her outstanding leadership, civic commitment, and cultural contributions to the Buffalo community. What we've been doing, Brentnie, is to just pause, applaud you, and then ask if you have a few words you'd like to say to the group. So please unmute and applaud Brentnie.
Thank you so much for this prestigious award. I am so grateful. It was an honor and a pleasure to mentor one of the UB students this semester. We actually connected. I was actually able to encourage her to relax. I kind of took her, we kind of did a spa day and everything, and kind of let her do her thing and just relax and just get out of the studies and stuff. And she did extremely well throughout the semester. So I'm so proud of her. She graduated. And I'm so excited about this process and this program of mentoring, and I'm looking forward to working with the students next semester.
Well, thank you so much. And we're looking forward to having you work with us. We appreciate that so much. And just by the way, about 16 people have little notes in the chat. So if you have a chance, to click on your chat button and just kind of read, because people are really congratulating each of you in that chat button. I hope you have a chance to look at that. We also will invite all of our award recipients as our guests next year at, we're sure, an iconic place somewhere in Buffalo, where hopefully the weather will be as beautiful as it is today, and we can celebrate, get to know each other better, give some hugs and shout outs, and then welcome another group of awardees next year. So that's our hope, that we will be virtual, not virtual anymore, but I thank you all for joining us for this virtual celebration. And I think that Grace said we will kind of stick around if you would like to just talk a little bit. I know it's a little awkward on a Zoom since you end up talking to all 30 people when you say something, but I'm going to now be quiet. I've said way more than I need to, and I'm going to let other people just share whatever it is you'd like to share with each other. And then as people feel the need to move on with their evening, please feel free to do that. So thank you all so much for coming.
Thank you.
Thank you.
Thank you.
Thank you
Thank
so
you.
much.
Thank you.
Right now, it seems like what we're all doing is watching people leave. Is there anybody that would like to say something?
Thank you for